everybody. Welcome to Digital Health Talks by Health Impact Live. This is Megan Antonelli, and I am here today with Dr. Christine Gall from Colette Health. As hospitals nationwide grapple with staffing challenges and the imperative to maintain exceptional patient safety standards, virtual care platforms are emerging as a critical solution. Dr. Gall will walk us through how virtual care is reshaping acute care delivery, starting with virtual observation for risk prevention and expanding into comprehensive virtual nursing support that enhances everything from admissions to medication verification. For our healthcare technology leaders listening, this conversation will provide actionable insights on implementation strategies, measurable outcomes, and the ROI potential of virtual care in your acute care settings. Hi, Dr. Gall. Welcome to Digital Health Talks.
Thanks so much, Megan. Happy to be here.
Yeah, it's great to see you again. I so enjoyed having a conversation with you and Becky at our event last week of Measuring the Health Impact. So it was great.
Yeah, it was a pleasure being there. And it's such a great forum to be able to share knowledge and ideas and thoughts. This is such a hot topic and an important place to be right now in virtual care. So really happy to have this opportunity.
Yeah, I mean, it's just amazing how much it's changing. And we talked a lot about the workforce and what it means for nursing to have sort of virtual tools and virtual assistants and virtual observation. But tell us a little bit about, that as kind of Colette's entry point to virtual care. And let's talk a little bit more specific around, sort of fall prevention and acute care settings and what it's being used for.
Sure. Well, virtual patient observation, the foundations were to allow hospitals to have a low risk but proven way of demonstrating measurable ROI, particularly in the area of falls. We did a recent pilot as an example, and we focused very diligently on training the staff and making sure that our trained observers understood the types of patients they were observing. And we were able to demonstrate a 84% reduction in patient falls, which translated to a $1.3 million in cost savings and or cost avoidance. So it was an incredibly successful program, and it's really what we're focused on, and as the entry point into virtual care. We do have a unified platform that has been developed so that when an organization is entering, as typically organizations do, in the area of safety and addressing falls, they can move seamlessly to adding on more comprehensive services like virtual nursing or virtual care for other service providers with the same hardware, with no additional investment in cost or evaluating equipment or anything. So it really is remarkable that we can do all of the various features and facets of virtual care with one single platform.
Yeah, and it's so important in terms of fall prevention. I mean, I think, as we've, it's starting in healthcare and when you sort of shift your attention to where so much, some the risk and the, where money is spent and kind of those indicators, falls is always, it's been a long time indicator of an area that needs to be addressed. So I think, that, and when we talk about technology, often the technology isn't necessarily, we talk about, the tech, it's not necessarily addressing an important problem. It's like we have these technologies without problems. And this is such a big problem that virtual nursing is able to assist with, and I mean, to some degree, that observation piece of it is, so important and yet, an easier sort of low hanging fruit, I guess, is what I'm trying to say. But as the sort of the tool has evolved too, you're also looking at, transitions for so sort of that support, so virtual nursing support. So talk a little bit about how the virtual care platform goes from just observation to truly supporting the nurses at the bedside.
Yeah, sure. So we intentionally designed our unified platform with the same hardware, same software, and same user interface for both virtual observation and virtual nursing to allow that seamless transition. That, it is a pretty major organizational decision and challenge to launch a virtual nursing project. So being able to do so with the comfort of technology that you've already used is really a plus. And we really listened to our customers who told us we don't want new ways of having to log in or separate workflows to go from one virtual care service to another. We don't want multiple systems to manage, so we have this one-stop shop for technology. And therefore, organizations can create endless combinations of workflows. When you look at virtual observation, we call that a continuous visit. It's an extension for either hours or days where somebody needs that ongoing continuous monitoring. You can decide to insert a virtual visit into that session where the observer's still doing their thing. They're still providing that safety monitoring. But in addition, the virtual nurse can knock and join that conversation, join that room, and then do what they need to do with that patient, whether it's virtual an admission, a discharge, maybe doing some teaching, maybe the admission or the bedside nurse said, this patient is, needing X, Y, or Z, and I just don't have time. Can you come and can you do that for me? So it really relieves a lot of areas of strain, stress, reduces bottlenecks or delays in care. So that that continuity, I should say, is really important for allowing organizations and teams to decide the best way to leverage technology. So in addition to that complex visit where you have that observer and then you're bringing in a nurse, the nurse can do their own thing. They can start their own visit, knock, join the room, do what they're going to do uninterrupted, and and then finish and leave, and then the patient has their room back. They are independent, and the session is over. So it can be any combination of those, and it doesn't just have to be obviously nurses. It can be any member of the care team. You can even invite, let's say, the observer says to the nurse, this patient seems really lonely. Maybe the best thing that nurse can do for that patient is invite their family member to join the observer in that room. So, again, the possibilities for leveraging technology are really endless here.
Yeah, and it is, in that time where there's so many critical pieces of the, kind of admission and discharge and transfer, and so many people involved in those to make that continuity and that connection is so important. When it comes down to kind of the specific risk prevention protocols, I know we're having this conversation. We're kind of digging into the fall prevention. It's fall prevention week, in terms of, creating awareness around that. Tell me about the sort of risk prevention protocols that the virtual care system monitors beyond falls, to prioritize sort of interventions in real time.
Yeah, so important. We all know that especially in our elderly population, it is typical that what ultimately creates their demise is initiated with a fall event. And then, the downward trajectory starts. And, so the area of concern and the focus on falls is so very important. But in addition to that, using this same technology can be done for patients at risk for elopement or contraband use. We actually have an AI-enabled follow patient feature that allows the observer to keep their eyes on the patient without even have to engage in any of their equipment. The So when you think about it, okay, that seems easy just to track a patient, but think about the situation where there's a patient in the room, they have a family member at the bedside, or the nurse comes in, or the housekeeper is in the room, the environmental services person is there. It actually has the sophistication to know which of the people in the room is the patient and then follows the patient. So that is a huge, that's a really powerful feature. And another feature is that allows the observer, let's say they're attending to one of the patients, they'll be observing multiple patients typically, and a patient that might have multiple drains and or tubes, and they just are subtly moving, and it will actually pick up on the subtle movement and alert the observer that, hey, this patient is moving. And that observer will already have the information from the bedside nurse that this person is at risk for pulling out their tubes. And here's the location of the tubes on their body. So if even under the covers, if they see somebody grabbing their right elbow and they know that there's a line there, they can redirect the patient and address that potentially dangerous situation. We also have something called AI-powered acuity scoring. It automatically takes information that is entered at point of admission or onboarding of the patient and tracks continuously around 50 metrics for that patient and assigns a score of high acuity, medium acuity, or fall acuity. And by acuity, when we're talking about this in virtual observation, we're talking about their busyness. How much does the observer need to monitor them to keep them safe? So a sleeping patient obviously is much lower acuity than a patient that is alert, awake, and possibly agitated, where you might have to engage with them more frequently. This allows for a number of different things. Number one, if you're thinking about a large call center where multiple observers are watching, dozens or hundreds of patients, a supervisor can actually assess or continuously see which of their observers might be having a really challenging assignment versus another observer that's having a really easy assignment, and do something we call, that's not very clinical, but load balancing, to actually move patients so that everybody can have a pretty consistent mix of patients. And obviously that's so very powerful, and it allows the observer team to do practice at the top of their capabilities and, keeps patients safe. So really, really important.
That's
And
amazing.
from the, yeah. And also, I mean, we have so many AI features that this is going to be a long answer if we have time for it. But, from the observer's perspective, the fact that they can then know that they move their busiest patients to their highest line of sight, their patients that are sleeping down here, but it'll actually alert, say, hey, this patient's waking up, because that tends to be the most risky time for patients. They forget they're in the hospital, they forget they just had surgery, and they're going to do what they always do when they wake up, they get out of bed. So this is the opportunity to come on screen, alert them, reorient them to where they are, remind them that they just had surgery, whatever it is. So you're really mitigating that risk. So absolutely important. And we have a second camera on our monitoring system that allows for night vision. So all of this, the tube pulling in particular, we can monitor patients crisply without turning on light. There can be absolutely no light source. So the capacity and the strength of the observation is consistent between daylight and nighttime.
Oh, wow. That's amazing. Yeah. I mean, and it is, I mean, you just think about, having been in the hospital, having certainly had family members and friends in the hospital, all of that time where there's so much vulnerability, to have that, constant observation and notification. But I think that piece about load balancing is really important, because that even, that speaks to that burnout, issue of, you can't really do that in a live health system setting, that when it's, it's hard for everyone, and then, things get intense, but you can then, lean on this system to be able to take some of that burden off your nurses in the,
Right.
in the field. So that's an amazing, sort of thing that I hadn't even thought about in terms of the power of these tools,
Definitely.
What, when it comes to, obviously, and it speaks to, that then leads to what why we've been implementing these technologies from the beginning is kind of patient safety, right? And avoiding unnecessary risk and errors. Are there specific things that you guys have done to sort of enhance and improve patient safety around, sort of complex procedures or medication checks and things like that?
Yeah, virtual visits and virtual nurses can provide real-time dual verification for medications that are considered high risk. And what that does, immensely, it reduces delays in care, avoiding that nurse to have to go find a second nurse. And for that second nurse, they can continue doing what they are doing without disruption. So it actually helps two staff for one intervention. The power of the camera is amazing. It provides a 20 times zoom capability. So you can actually zoom in to very small text across the room and be able to review it and see it. So what that does for the virtual nurse is if they're doing, if they want to make sure it's the right patient, they can zoom into that band and check the patient's name, ask them their name and date of birth, which somebody will answer probably 100 times in a day. And also the medication label. Are you giving the right drug at the right dose at the right time? Can look at the orders that are on the computer. So a number of different features that enable that virtual nurse to really be that great second set of eyes. The camera also, the feature also is so powerful. So if that, we have a trend that has been really, I would say, impacting, or it's been evident in bedside care, and that trend is that the average tenure of the bedside nurse is decreasing. Right now, I was actually at an event yesterday in the state of Wisconsin. They said the average tenure of nurses at the bedside is 2.5 years. That is much lower than when I began practicing as a nurse, where I had lots of people directly around me that I could ask for something that I wasn't sure of. So the ability to do virtual mentorship and actually have that virtual nurse zoom in on something, and together they can talk to the patient and look at a wound together and, make a plan together, that's so very, very powerful. And another plus is that the virtual nurse, if they're offloading some of the time intensive services like an admission or a discharge or some intensive teaching from the bedside nurse, their workflows allow them to do that uninterrupted. They are not going to be called on to answer a call light or to get a phone call from a physician or from another staff member. They have uninterrupted, dedicated time. So what that translates to is more time spent in these the times of the admission that are most important, the admission, the discharge. And when they can be uninterrupted, they can pick up easily on cues. Is this patient really understanding what we're talking about? Or you can tell by body language, the patient isn't asking something, but there's something definitely on their mind. So they can explore that more. And what that translates to ultimately is decreased complications, possibly decrease in length of stay, and decrease in readmissions overall. And obviously for the patients, they feel, gosh, this person took the time uninterrupted. I felt cared for and cared about, and I feel prepared to go home now. So, for everybody, it really has a lot of impact. And having a smaller group of virtual nurses also has another impact on the quality of care. Because for standard practices like admission and discharge, it will ensure that every patient receives care delivered constantly and consistently at the highest standard, so that patient will get consistently the same level of care. And that's so very important for those critical points in a patient's admission.
Yeah, it really is, really one of the most important things. You mentioned also, though, as we talk a lot about kind of workflow and, sort of leaning to sort of processes within the organization. And when you're implementing something that's this, sort of this new, and what are the safeguards, or even the, sort of as you're in that implementation, best practices for ensuring that, this integrates well with existing workflows, and is there a lot when that implementation happens, is there a lot of, redoing of processes and protocols that have to happen, or is it relatively, seamless and easy to do for those who haven't done it yet?
Yeah, so one common misconception, I think, when you get into virtual nursing is that you're just going to insert technology and a virtual person into your same workflow. But one thing is very evident from the integrations and the implementations that we've been doing with Colette Health and our partners. This is your opportunity as an organization to really critically look at your workflows, because virtually every workflow has some area that is either a redundancy or an unnecessary step that is adding intensity to a process. So it's really an opportunity to right size and to level up all of your workflows. So I was just on a call actually before you and I met today, talking about a perioperative virtual nursing workflow, and they were able to remove some really critical unnecessary steps that included, in some cases, paper processes in this organization that is highly electronically engaged, and everything is so integrated that it was just shocking, even to some of the leaders that weren't aware of the processes and the workarounds that had happened, that we were able to clear those out. So that's a really interesting thing. But at the same time, as I mentioned before, once you have the processes that are the best practices, that's when virtual care can ensure that you hit that mark every single time, because you'll have the same folks that are doing those really important activities with patients.
Yeah. No, that is, we always talk about sort of the program out of Hawaii, the getting rid of the stupid stuff, right? When you do implement a new system, it gives you that opportunity to reevaluate those processes, reevaluate those protocols, and hopefully that's the point, right? Build new ones that are more both efficient and, bring in more safety. And then, one thing when I think about all of this, I mean, it's that you're collecting so much data, right? I mean, there's so much observation data. There's so much, opportunity to then use that to begin to predict and learn more about how to improve those processes. So tell us a little bit about where that, sort of the predictive analytics of all of this fits into the platform that you guys have built.
Well, I think what you're talking about is measurable improvement, and having the metrics to really identify whether or not this insertion of technology has achieved the desired outcome. So obviously, reduction in patient falls is one of the most common things and noteworthy changes that we're talking about when we're talking about observation. And because of the importance of, falls and what it can do, particularly to our elderly population, it's so very important that we mitigate that as much as possible. We've also seen a remarkable correlation between the hours of observation and falls. So as hours of observation increases, patient falls decrease. So being able to apply that technology, recognizing that if you look at the risk stratification of your patients that are admitted to a hospital, the majority of them will have some risk for fall, either because of their mental state, because of the medications they're on, or maybe the injury that brought them into the hospital. So many patients could benefit from some level of virtual observation. So the correlation that we identified from increased observation and decreased falls makes a lot of sense. Another important metric is the cost avoidance or cost savings that's associated with a reduction in one-on-one sitters. It's common that if a patient needs a one-on-one sitter, they're going to pull them out of staffing. And often, because of shortages, they don't have somebody to replace that person with a full assignment. So that means that the patient care assistant who remains on the unit has to take their assignment and the other patient's assignment, which means that probably they aren't going to be able to manage that. So the overflow will go to the nursing staff who are there. So that prevents them from practicing at the top of their license and expertise as well. So there's a real snowball effect. So the impact of being able to keep somebody in their role at a full assignment is so very important. And being able to track the actual ability to decrease one-on-one sitter usage is so important. So it's also important related to that fact to look at the long-term impact. When you keep staffing at the right level, and you don't have to pull people, allowing everybody else to pick up the rest, you're going to see an impact in resilience of your staff, and you should start to see a decrease in some of the turnover that occurs because of burnout. So that's really, really important. And also, this is another interesting thought that I probably didn't consider. When you think about a robust virtual observation program, that observer is going to have the right level of engagement with their patients. They're going to address patient needs and group the requests of that patient and keep them engaged. What that translates to is less using of the call lights. And call lights, unfortunately, are a very high, they cause a lot of unproductive and reactive time. So it takes somebody who had their plan for how they were going to be efficiently providing care for all of their patients, and it stops them from doing this to go do this. And they might not even be the right person who answers that call light. It could have been answered by perhaps, a different staff person. So that does cause some level of inefficiency. So what we've actually had some of our customers study that, and they're able to identify a statistically significant reduction in incidental overtime because nurses were actually able to take their lunch and avoid staying over to document because they were able to manage their patient assignment as they planned with fewer interruptions. So that's a really remarkable thing that I think is noteworthy and important to keep track of.
Absolutely. It goes back. One of the things you said about, the fact that sort of nurse at the bedside time has been reduced to 2.5 years. And it just brings me to say why, right? Why has that happened? It was a career that you would go into and stay in love and do for years. And now it has changed. And now what excites me about all of this and the conversations I've had and learning about it. And also that a lot of times the ability for nurses who are older to be able to continue to practice through virtual nursing and be at the bedside that way when they can no longer, sort of be on the floor is also amazing. But I'd love
it's definitely an extension. It's a new career pathway, mm-hmm. which I absolutely agree. Is something that is getting lots of attention when we're talking about how to manage some of the workforce challenges.
Yeah. And we talk a lot about the nurses, in the health system how are they handling it? How do they like virtual nursing? But I think it's important to talk about how the nurses who are doing the observation are also enjoying it and that an opportunity as well. So, tell us a little bit about, you've been a nurse for many years, and sort of what your perspective is on kind of where will this go? I mean, because there's a lot, we see some resistance as physicians resist AI and everyone resists, technology a little bit. Change is always hard. But in terms of like, what does the future of nursing look like with these tools as, their companions and as their helpers and assistants?
Yeah, well, my crystal ball says that I think there is definitely a place for AI in the provision of care. Anytime there are tasks that are redundant, repetitive, real low-level functioning tasks that AI could possibly eliminate or figure out a workaround for, I think those administrative kinds of things should and will be peeled off. The time spent documenting, I've actually had the opportunity to speak with some folks who are trying to tackle the documentation drain using AI, and some are using speech, which is ambient scribing, and then taking that basically recording and organizing it into a note that somebody would actually write. That's one way, but there's other ways that they're actually using cameras to track what's happening in a room, and then are documenting what the camera and the AI are interpreting is happening, along with what is occurring verbally. So it's fascinating where this is going, and I think what this is going to do is some of the things that when I was practicing, there are the painful things that you had to get through to get back to the bedside to be with your patients and do the things that brought you into nursing. I think we're going to see a lot of opportunity, and the future nurses are going to say, "You had to do what, and why did you do that?" So I think there's lots of opportunity for the future, and also helping with decision support. The current example that I like to point to is when you're looking at CT scans and the films, and when radiologists read them, it used to be they started out with a couple dozen images that they'd have to look through and interpret. Now that's hundreds upon hundreds of images. And, obviously we have these metrics that talk about efficiency and productivity. And if it used to take somebody doing things manually 10 minutes, they're expecting you to do it in 10 minutes or less, even though the work might have, multiplied exponentially. So I think that there will be similar things that happen as even identifying, we have such an issue with workforce violence with staff. 2 nurses every hour are, the victims of violence when they're at work. And that's just unacceptable. So there's technology out there that actually is measuring patients a different, automatically and behind the scenes. So there's nothing on the patient, nothing that they are having to respond to, but just seamlessly monitoring patients who are either becoming more anxious, more depressed, or maybe becoming violent, even before the symptoms of that are evident. So, staff can do what they need to be safe. And I think that those are features that are going to be so very important in the future, because what's happening right now is simply tragic and unacceptable.
Yeah, no, absolutely. And it just goes back to kind of the sort of both the patient safety, the professionals' safety, and what can be observed and what can be done to kind of make all of those things better and more seamless. I don't know if you've seen the Pit. It just won the Emmy. I was so excited to see, but that was they captured many different aspects, but of course, in that there was a very powerful scene where the lead charge nurse gets attacked, and it was, it really brings that to light, and that burnout discussion and where these tools are useful, and of course the 24 hours they're focused on, because it was this incident that was happening, they were absent of their technology, right? They didn't have any of their technology. So the tools that we've implemented over the years, I mean, that's really what EHRs came about for, was patient safety. And now there's, so many tools for all of this. And I feel like we're just finally seeing the applications really, reach their potential and have that like sort of scaled adoption that we're seeing results. And you guys have just seen incredible results. So it's amazing to hear about that. In our last few minutes, I mean, do you want to just tell us a little bit? Did you have anything more that you wanted to share? You can tell our audience how to reach you and how to get in touch.
Oh, well, great. Well, I just want to say, I think that we are at a critical point in healthcare. And when I think about my career, I would say the last point that reaches the level of criticality as we are at now was probably when the electronic health record came on the scene, and how that impacted the way we provide care, the way we think about care, and having to understand and be able to work with technology at a level never before having been seen. So we are here now again because of, everything. We talked before about part of the workforce shortage was understood because there is an incredible population of senior nurses that are aging out, and this was to be known and expected. Unfortunately, the group behind them didn't keep pace. But at the same time, we're seeing patients that are aging. I was at the conference I was at yesterday. She called it the silver tsunami, the aging population, and with that comes more needs for access to care. So not only are we having the challenge with our existing workforce, we have a higher demand in our population. And so the combination of those two things, along with more comorbidities and complex care. So it's not, you don't have your easy patients anymore. So it's just becoming a challenge. And in my mind, for those reasons, being able to carve out some of the difficult work with a virtual nurse or a virtual clinician of some sort is so very important, but we have to get it right. So, what I like to talk about when I talk about my organization is that we are true partners. When somebody calls us a vendor, I actually cringe, because to me, that is not, we're not about selling things. We're about helping you solve problems, addressing your pain points, looking at the data with you, coming elbow to elbow, walking the halls, and deciding the best strategy to address your safety and workflow issues. So I'm very proud of that as the chief nursing officer. We have a team. Every single member of my team is mission, vision, and values driven. And I say that unequivocally, and that's very important to me in my clinical heart. So as far as getting a hold of me, we have a fantastic website at colettehealth.com. My email address, if anybody wants it, is christine.gall@colettehealth.com. And I am just a click away. You can access, there's a way to contact us on the website as well. That I'd be happy to connect with you. Everybody virtually, I didn't mean virtually in the virtual sense, but largely all organizations are at some stage of either doing, implementing, or considering virtual care. So we would love to be there with you.
Yeah. Well, it's amazing. You mentioned that silver tsunami, and we know it's here and it's coming, and it is, that demand is changing, changing healthcare. And, it's clear that Colette Health is really addressing those operational change, needs and the problems really at, for hospital executives, to improve, patient care and patient outcomes. So I thank you so much for joining us today and sharing those insights, specifically around, fall prevention and some of those really critical, points of care that indicate, safety and protect our patients. So thanks again for joining us. A pleasure to chat, and I look forward to seeing all the things that come out of this as it evolves. So this is Megan Antonelli for Digital Health Talks. I want to thank our guests for joining us. And if you want more information on health impact, you can join us at healthimpactlive.com. Until next time, keep innovating to fix healthcare. Thank you.